For the last couple of years, I've been writing a book about the science of happiness, and today's podcast is taken from a conversation I had in April 2019 with Dr. Michael Greger. I hope you enjoy. Today I'm speaking with Dr. Michael Greger. Dr. Greger is a physician and internationally recognized speaker on a number of important public health issues and a best-selling author of multiple titles, including the instant New York Times bestseller, How Not to Die. He's testified before Congress, he's appeared on shows such as The Colbert Report and Dr. Oz Show, and Oprah Winfrey invited him to be her key witness in the infamous Meet Defamation trial. He is a council of directors, a member of True Health Initiative, which is a coalition of more than 360 world experts representing 35 countries who together offer clarity as to the principles behind healthy eating and healthy living. Michael, thanks so much for being here.
So happy to be here.
And I can see that you're on a walking treadmill.
Of course.
There's so much evidence that shows that exercise is correlated with improved mental health. What is the causal evidence like at present? Because I know that there's more stuff coming out, but what is the causal evidence between exercise and mental health at the moment?
Yeah, so that is an excellent question. So this is a perfect example of where you could imagine a correlational evidence not necessarily translating into causal evidence. So, for example, as you can imagine, you do a cross-sectional study, snapshot in time, and you just ask people, do you exercise or not? Or do you have symptoms of depression or not? And lo and behold, those people who exercise a lot report they have very low, on average, symptoms of depression. And you say, awesome, exercise helps depression. Well, not so fast, right? Maybe exercise leads to less depression, or maybe depression leads to less exercise. You can imagine how if you're feeling crappy, you're not going to go out for a run, right? So maybe it's what's called reverse causation. Maybe it's the other way around. And so what you need is this interventional study where you intervene and randomize people to different groups and see if you can actually help them. So that's what was done at Duke University. They randomized men and women over age 50 with major depression. So we're not talking about just like people who have a kind of low mood or something, but people with major depression to one of two groups, an aerobic exercise program for 4 months, or you take an antidepressant drug. In this case, it was Zoloft, one of the SSRIs, kind of a Prozac-like drug. So before exercise, the way we measure depression is something called the Hamilton Depression Score. And so before exercise, people were up around 18, and basically anything over 7 is considered depressed. So these are people who are pretty depressed. Within 4 months, the drug group came down to normal. Right, which is what antidepressants are supposed to do. They're supposed to help depression. But what happened to the exercise-only group? No drugs. They had experienced the same powerful effect. And so the researchers at Duke concluded, hey, exercise could be an alternative to the antidepressants, given that they've shown it to be a feasible, effective treatment, of course, without any side effects. Critics of this study have pointed out that this was a group exercise program. Right? So what they did is they had people come in because, you can't just, if you say, okay, you exercise, you don't exercise, this group exercise, how do you know they actually do it, right? And if nobody exercises, well, then you just wasted a lot of money doing a study. Okay, so they did a group exercise. You had to actually come in 3 times a week to do a group class. Right? Then we can actually make sure you're doing exercise. Okay, but then, that adds like a confounding factor. Maybe the only reason the exercise group got better is because they're actually forced to get out of bed, interact with people,
the connection of the group,
the social stimulation, and maybe it had nothing to do with the actual exercise. So before you could definitively say, look, exercise works as good as these drugs, what you need to do the same study, basically, but like a third group. You had a third group, they just do exercise alone, but with no extra social interaction. And that's exactly what the same Duke University researchers did. They realized they were not going to be able to get definitive answers until they had that third group. And so they created what is, I believe, today the largest trial of exercise for people with major depression. This wasn't just older adults, but younger adults as well. So they added this home exercise group. There's the supervised exercise group, the drug group, and then the home exercise group. And so what happened? They all work just as well in forcing depression into remission. So we can say now with confidence that exercise is comparable to antidepressant medication in the treatment of patients with major depression. And since if you now that was the biggest study, but there have been a number of studies. You put all the studies together, and researchers have indicated that indeed exercise does have a large effect on reducing depression symptoms, calling it a very useful, powerful intervention. Unfortunately, it's very rarely prescribed by doctors. You go to a psychiatrist, and they're not going to tell you to go buy running shoes, but they're also not going to get kickbacks from the running shoe company like they may get from the pharmaceutical company.
That answers my question. I was just about to ask that because it is rarely prescribed. I know that it was. Is it slowly catching up? But like, is that? I mean, big pharma obviously is. That's a big one. But like, is that the major reason, or do you feel like it's at least moving in the right direction? Are doctors starting to prescribe it more and more? Aren't they called like green prescriptions or something like that?
Yeah, no. So there is a lot of it's ignorance. I don't want to paint doctors as just kind of being greedy with their handout. I mean, there's a lot of ignorance. They just simply don't know about the power of simple lifestyle interventions like exercise to have these pharmacological-like effects. I mean, doctors will say, well, of course, exercise is good for you, but it's actually going to help with major depression. I mean, I think people are skeptical, but they're just not familiar with the evidence. And that's why I created nutritionfacts.org, because there's this wealth of data out there, this mountain of good evidence about the power of lifestyle, about the power of food, exercise, smoking cessation, to affect health, even reverse chronic disease in some cases. So doctors will indeed incorporate it more into their practice. Thankfully, I mean, the best news, I think, on the block is the formation of this entire new specialty within medicine called lifestyle medicine. There's always been preventive medicine, but lifestyle medicine uses the lifestyle approaches to actually not just prevent disease, but to treat and potentially reverse its progression as well. So there's now an American College of Lifestyle Medicine. You can get, certified by the Board of Lifestyle Medicine, and the conference grows every year. I mean, it's just amazing to see people kind of reinventing their practices, practitioners, reorienting their practices. And because it's not just good for patients, it's good for doctors too. I mean, chronic disease, about 80% of what walks into a door of primary care offices, primary care physician offices, is these chronic disease, lifestyle diseases like heart disease, obesity, high blood pressure, diabetes, type 2 diabetes. And these are very frustrating conditions to treat for both doctor and patient alike, because all we have are pills and procedures that don't treat the underlying cause, and just kind of slow the rate at one's progression. So you can slow the rate at which your diabetic patients go blind and get on dialysis and have their lower limbs amputated, but you're not going to reverse the disease unless you treat the cause, which is lifestyle. And so all of a sudden, I mean, why did we go into medicine in the first place? Right? If doctors want to make a lot of money, look, they become stockbrokers or something. People go into medicine because they want to help people. They want to heal people. It's very frustrating to do that now, but with these powerful new tools, like exercise, we can actually get people's health back, and that makes everybody feel better.
You mentioned earlier the word side effects, and some of the side effects of antidepressants are sexual dysfunction. I think it affects around 70 to 80% of people, long-term weight gain, insomnia, nausea, diarrhea. But exercise, as you said, can achieve the same results as these antidepressants, but without the harmful side effects.
I love that you said harmful, right? Exercise got lots of side effects, but they're all good side effects, right? And so not only is the exercise helping your brain, if that was all that exercise was doing, you have major depression, look, that's enough. But the fact that it's also increasing your cardiovascular health, that's also improving your immunity, that's also doing all these other wonderful things to your body, that's the beauty of lifestyle medicine, is that you only got good side effects.
I enjoyed. I was looking at on one of the videos on nutrition facts. I think it was a study done in Japan that showed that exercise is so important that not walking an hour a day is considered a high risk behavior alongside smoking, excess drinking, and being obese.
Yeah, no, and I think that's important too. So when you find that, for example, these amazing statistics about how much longer you can extend your lifespan by, doing something as simple as walking every day, you can really turn that around on its head and say, wait a second, not walking cuts years off your lifespan, right? That's basically the equivalent thing, but just framing it differently, I think may be able to motivate people. And so, right, we're not talking, that you have to go out and do an Ironman. We're talking simple walking. It's an exercise almost anybody can do, no matter your fitness level. You can start slow, and you see these remarkable longevity benefits. In fact, most of the longevity data actually surrounds walking, just because you have the large number of people doing it. It's really life or death decisions, whether or not you're going to get up, you're going to move every day. We were built to move, but any amount is better than nothing.
There's obviously so much conflicting advice as to what constitutes a healthy diet, and as we have alluded to, there's many factors. You talked about how, like the tobacco industry back in the day, confusion is good. So for a lot of these industries and companies, they benefit and profit from this confusion. If people are confused, then great, because it's just like, okay, businesses just carry on because it's just too much. So just for fun, just as a thought exercise, let's imagine no one had an agenda. Why do you think there still would, like, people would still not be able to agree? Because every day there's a different, whatever, like paleo, vegan, Atkins, like everyone's got a different opinion. Everyone's almost like religious about their opinions. Why is there so much confusion?
Okay, well, so you're right. So a lot of them, as you mentioned, a lot of the confusion is manufactured. The tobacco industry had this famous internal memo which was leaked called "Doubt is our product," basically. And so this is the PR company that was working for the tobacco industry and said, look, we don't have to convince people smoking is good for you, but our product, what we're trying to create is just doubt. All we have to do is create doubt in the minds of smokers. Yeah, some people say it causes lung cancer, but other scientists says it doesn't cause lung cancer. So in hopes that people just throw their hands up in the air, continue to do what's easiest, eat whatever's put in front of them, continue to smoke their cigarettes, etc. So confusion reigning supreme is exactly what these industries that don't have our best interest at heart, that's what they really thrive on. But there is remarkable consistency in the medical literature going back decades as the core elements of healthy eating. That's important to understand. And so, yes, if you look at the blogosphere, oh my God, everyone's got crazy opinions. You look at like diet books coming out, but if you actually look at the science, the science has been remarkably consistent. And of course, you can get, the beef industry, funding some study to manipulate the results to get something crazy. But if you look at the data overall, period, or even better, you just look at the studies that were independently funded by NIH or something, by taxpayer dollars, very remarkably clear that we should increase our consumption of whole plant foods, fruits, vegetables, whole grains, legumes, beans, split peas, chickpeas, and lentils, nuts and seeds, herbs and spices, mushrooms, basically real food that grows out of the ground. These are our healthiest choices, while decreasing our intake of meat, eggs, dairy, and junk. You see a graph that says, 5,000 people feel better, and it just doesn't have the same impact as one person describing how they felt better. But the problem is these kind of glorified anecdotes are just that, and can be used by snake oil charlatans to sell all sorts of garbage. This one person got better. Here's before and after pictures, testimonials. Those are the classic. When the science is perfectly clear, and the reason they don't talk about the science is because the science doesn't support their whatever kind of snake oil product. We need to just be hard-nosed, look at the data. And if it wasn't such a life and death important decision, then who cares? Believe people's opinions and beliefs and, whatever kind of fad of the day, what are you going to wear today? Well, whatever. That's you make whatever decision you want based on whatever flimsy, fad that comes along. But when it comes to something as life and death important as what to feed yourself and your family, I mean, the here in the States, the American diet #1 killer of men and women. Now bumping tobacco smoking to #2. Smoking only kills about 500,000 Americans every year, whereas our diet kills hundreds of thousands more. #1 cause. So it's like our most important health decision. So if there's any decision in life to be made based on the evidence, it should be that one. And of course, same thing with all the exercise data. Although exercise data is less conflicted, there's not an industry out there necessarily that's is going to profit from people being sedentary. And in fact, the opposite. I mean, the junk food industry, Coca-Cola famously got caught secretly funding this group that just came out and was blaming the obesity epidemic on inactivity, saying, oh yeah, it has nothing to do with the food, it's all inactivity. So there's actually economic interest supporting exercise out there, but still people are not doing it enough.
A phrase I've heard quite a few times is the talk but not sing test. So like when people say moderate exercise, it's like, what does that even mean? A talk but not sing test is a phrase that's come up a few times. What does that mean?
Yeah, so you can imagine it's kind of how out of breath you are, basically. And so you can define kind of various gradations of exercise on whether or not doing that exercise you're able to carry on a conversation. And you can imagine if you're doing vigorous exercise, you couldn't even, you can get a couple words out, right? But you can't really carry on a conversation because you're so out of breath, right? That's vigorous. Okay. But you can imagine another level of exercise, a more moderate level of exercise, where, you carry on a conversation. You're doing a good, vigorous walk, 4 miles an hour, you really, but look, you can still carry on a conversation. You're not so out of breath, but not so, but you're active enough that you really don't have the kind of lung capacity left, the reserve to start singing, really kind of belting it out. You really got to kind of stop if you want to do a little karaoke, and so that's kind of been used as kind of there's obviously scientific methods you can actually measure it, but just as a way of kind of for the kind of lay audience to explain the differences.
What does a fulfilled life mean to you?
Fulfilled life is reducing suffering in the world, is using your inborn talents to get out there and do something good for the planet, and that's reducing as much suffering as you can possibly do. That's what gets me up in the morning.
Nice. And if you had to give our audience something that they can go off and do today, what would that be? If people are interested in my work, obviously they can go to nutritionfacts.org and they can sign up for free. Everything's free on the website. There's no ads, no corporate sponsorship, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love. And so, you can check out, subscribe, new videos and articles every day on the latest in evidence-based nutrition. Too bad there isn't an exercisefacts.org website talking about all the new great science in exercise physiology. Hopefully, someday someone will create one. Dr. Michael, thank you so much. I really appreciate you taking the time and speaking with me while having a good workout yourself when you're on your treadmill. I appreciate it.
Absolutely. Good luck with the book.
Happiness.info